If bile duct stones like this are found during the operation, or indeed if we discover them afterwards, they will need to be treated, because unless we do treat them, your treatment won't be complete. What we do is we pass a long flexible telescope through your mouth under sedation, down the gullet, into the stomach, and find the bottom end of the bile duct where it enters into the intestine. We then use a special little instrument to go up into the bile duct and retrieve the stone. This procedure is called an ERCP, and if you do need one, we'll tell you lots more about it nearer the time. One of the things people ask me most often is, how quickly am I going to recover? Of course, everybody's different, but I think you might be very pleasantly surprised to find out what might be possible after just a few weeks. Hello, Margaret.
Hello, Mr.
Nice to see you again.
And you.
So here you are,
Yes.
6 weeks after the operation.
I know.
I bet
Incredible.
you didn't think you'd be eating a cream tea at this stage, did you?
Definitely not. It's fantastic.
Tell me how it was in the first few days after your operation, after you got home.
Well, the first day I remember taking, as you advised me, my medication.
Your painkillers?
Painkillers,
Yeah.
yes. But I didn't need anything after the second day.
Right.
It was just a dull ache, which then suddenly it just passed. I felt absolutely fine.
Fantastic.
Within a week, I could almost say I was almost back to normal.
Well, that's really good, because you know,
Yeah,
normally what I
yeah.
tell people is that within about 2 weeks,
Yes.
90% of people will be
Yes.
90% better.
Yes.
So it sounds like you were rather better than that, which is
Definitely,
fantastic.
definitely. I felt absolutely fantastic.
And what about things that you sort of did physically, like walking and going to the shops and...
I gradually built it up. I just sort of went to the top of the road after the first week and then gradually went a bit further. I do like to go swimming, but I didn't attempt that until 4 weeks after.
4 weeks?
4 weeks.
Yeah, okay.
That was basically to let the wounds heal.
I was just trying to get a feel for
Yes.
when you thought you might have been able to do a little bit of
Yeah.
two-stepping or whatever.
I feel fine now. I think really probably I could go and, you know,
Great.
sort of dance the night away, but it's just I've been more cautious than...
And you know,
Yeah,
you remember
tempting.
how I said to you, when you get home, what your family will do is wrap you in cotton wool and say, oh, you shouldn't do this, and you
know,
shouldn't do that.
I know.
And I said to you, you mustn't let them do that.
That's
You must
right.
actually get off and do things, because
Yeah.
there is good evidence
Yeah.
that the more people do, the quicker they
Yes.
get over
Yeah.
it. What about driving? Well, we'd advise you not to drive in the first week after your operation, because if you do, your insurance may be invalid. But after that, if you feel confident and comfortable, please do. We're not actually encouraging people to eat fat after the operation, but I think what we're saying is that whereas before it would have been a no-no, now you should be free to eat almost anything you want.
Yeah.
I mean, obviously there are some patients who'll find that foods disagree with them and still will. And
Yes.
celiacs and so on will have to avoid gluten and all that sort of thing.
Yeah.
But by and large, you've got carte blanche
Yeah.
to have what you want. And
Yes.
hopefully this signals the end of that fear that you're going to go out and have a lovely meal, but
Yeah.
unfortunately suffer terribly afterwards. And
Eating.
in terms of eating, because here you are with your cream tea, which I haven't
Yes.
quite tucked into yet, but I'm sure you will in a second.
Oh, yes.
I mean, did you feel... obviously beforehand you would have avoided foods like that.
I had to because of the pain and also the sickness. That
Yeah,
bothered me
absolutely.
more than anything.
And now?
And now I can eat anything,
Fantastic.
anything at all.
I think you better tuck in then, haven't you?
Okay, I will. Thank you very much.
Looking after your wounds and the dressings. Now this section is really important because when you get home you'll need to know what to do with your dressings. On the day after you've left hospital, it's quite in order to have a bath or a shower, but when you do that, these white dressings will get wet. When they do get wet, it's impossible to dry them. So what I suggest you do is simply to take them off, but try and leave underneath the little sticky strips, the flesh-coloured strips that you can see here. After you've removed these white dressings, it's quite in order for you to continue to have a bath or a shower every day if you wish, with the sticky strips in place. But I would just recommend that you don't rub, otherwise they will come off. After about a week, you can simply take the strips off as you would an ordinary dressing. Now, if you get any sort of ooze, and particularly this applies to the tummy button wound, simply mop it up with a tissue and everything should be fine. What happens if my symptoms don't disappear after the operation's been done? We operate in the belief that what we're going to do will cure your symptoms. But sometimes that doesn't happen, and we may need to provide an explanation and investigate as to why. The first reason might be that you've got bile duct stones that we hadn't hitherto appreciated. As it says elsewhere in the DVD, we can investigate this and treat as appropriate. The second reason might be that you've got a collection of blood or bile in the space where the gallbladder used to be. Again, we can investigate that and manage it as appropriate. The third reason might be that your symptoms weren't actually due to the gallstones completely, but due to something else, like irritable bowel disease, hiatus hernia, or dyspepsia, all of which can produce symptoms that overlap with those of gallstones. If that happens, we shouldn't conclude that the operation wasn't necessary, only that it wasn't the complete reason for all of your symptoms, and further investigations may need to take place to try and deal with those as well. We just want to remind you that the results of surgery can't be guaranteed, and no matter who does it, where it's done, or how carefully, there are always going to be risks. This is not something we want to say to discourage you, but just to be realistic and honest with you. Remember that at the end of the day, your safety and a really good outcome is our primary concern. And if there's anything at all that you're unclear about, please feel free to ask. It's clearly not in anybody's interest that you remain confused about what we're planning for you. We don't normally follow up patients after a routine cholecystectomy because, to be honest, there are very few problems that your GP couldn't resolve. But if there are any reasons that you'd like to see us again, or your GP would like us to, we'd obviously be only too pleased.